السلام عليكم. On n'a pas l'option vidéo. On n'a pas l'option vidéo. J'ai compris. On ne voit pas les autres. On voit.
السلام عليكم.
السلام ورحمة الله.
لن صباح
كيفك فيك أستاذي؟
سعيدك شي بخير.
مزيان، العائلة بخير.
الحمد لله الله يبارك فيك.
الله يحفظك. كاين شي حرارة؟
ايوا شويه. الصوت مزيان؟
انت مزيان تنسمعك.
السلام عليكم، لاباس عليكم؟ في امان الله.
فهد بخير.
الحمد لله. كيفكم؟ كلشي بخير. سي مستشهد، لاباس عليك؟ في امان الله.
اهلا تلقاو لاباس؟ شي بخير؟
الحمد لله الله يبارك فيك. الحمد لله الحمد لله. شكرا. Bon, je vous dis dans 5 minutes, Inch'Allah. À tous.
Bonjour, monsieur Darqawi.
Bonjour Ustad. لاباس عليكم في امان الله.
Comment ça va?
خليك يا استاذ. الحمد لله في امان الله وحده.
On démarre dans combien de temps? Dans 5 minutes, c'est ça?
On attend que les conférenciers nous rejoignent parce que je ne sais pas. À peu près 5 minutes, 10 minutes, Inch'Allah, on va démarrer.
Très bien, alors à tout de suite.
Merci.
Bonjour, c'est Azari.
Bonjour, comment ça va?
Alhamdulillah, Allah يحفظك.
كيف سيبو بالزقموت لاباس عليك؟
الله يعز بك. شخبار الوليدات؟
Tout va bien? الحمد لله الحمد لله.
الله يبارك فيك.
عبد الصمد bonjour.
أهلا. كيف الأحوال؟
عبد الصمد.
Comment ça va?
Comment vas-tu? Ça va et toi?
لاباس عليك؟
الحمد لله. Tout va bien.
Tout va bien, alhamdulillah.
C'est بالزقموت.
Bonjour, السادة لاباس. Vous allez bien?
لاباس عليك؟ صحة لاباس؟
الله يعطيك.
بارك الله عليكم.
حفظك الله. شكرا.
الله يبارك فيك.
فهد. شوف فهد. Tu veux فهد. La prochaine fois علاش ما تديرش انت هذاك هذاك كي تيدير حكو باش تيدير موراه ليماج ديال لو
ما بغيتش نفقسكم يا استاذ. انا هو واحد زوين عندي.
دير هذه احسن. ça c'est génial. Ça c'est comme ça, c'est génial.
Ça, je partage avec vous mon rêve de chaque jour. Ça fait mon rêve de chaque jour.
Très belle. Elle est très belle. En plus, c'est le rêve de tout le monde en ce moment. Elle est très belle, la photo. Chez des îles ou chez des îles.
Je sais pas, j'ai trouvé ça sur Zoom.
Miami Beach.
Miami Beach. Ou la Samad San Diego.
Non, non, c'est pas San Diego. Alaykoum salam.
الخير من الأردن.
أهلا سي صبيح، كيف الأحوال؟
الله يخليكم مشتاقين.
الحمد لله.
Can you all hear me?
Yes.
Vous pouvez
Hello,
m'entendre?
Professor Scott.
Hi.
Good. Hi.
How are you?
How's everybody doing? Sorry to bring English into the conversation.
No. No problem.
Hello
It's a pleasure to be
Dr.
here.
Saad, how are you?
Oh, good
So Charles, hello from Jordan. My name is Ibrahim Shbeh. We met several times.
Nice to see you again. How are you?
How
Thank you.
are you, Dr. Sabeh?
Hello.
Hi.
Very good audience here.
Bonjour à tous.
Bonjour.
Bonjour.
It's really a pleasure and an honor to be here. I'm very happy to participate in this great event.
It's a great pleasure. Hello, do you heard me, Fahd?
Bonjour, Sad. Hello, how are you?
Yes.
How are you? Yes, we hear you so very well.
Good afternoon, or good, maybe it's good morning for our colleague from in New York now.
Yes, it is good morning.
Yeah.
Late morning. Still morning.
It's a great pleasure to share this webinar, and hope that everything is okay with COVID-19 now in New York.
Yes, everything is getting much, much better. The numbers have gone down dramatically. We're now doing many, many more neurosurgical operations. So things are returning quickly to normal. And every week we're opening up more and more operating rooms. We should be back to normal in about 2 weeks. Thank you for asking. How are things in Morocco?
Yeah, it's okay also. I think that Morocco was one of the first countries who really applied this measures of confinement and distanciation.
Yeah.
And this since now almost 2 months, and it helped us a lot. I mean, our health system never had the really in difficult situations. So now the number of cases is decreasing since 2 weeks, and the activity is going to start, I think, in already this week. I think people starting this week already.
That's wonderful.
Nice to see you, Professor Khamlishi.
Me too, Dr. Ibrahim. It's
Hi,
great
everybody.
to have you and to see you.
Thank you very much indeed.
Thank you very much for the organizers, for the Moroccan Society of Neurosurgery, for the where is our coordinator,
Sure.
and all the group of FAD and others.
Thank you, sir.
Thank you very much. Et je vois à côté notre ami Bou Youssef. Je ne sais pas s'il m'entend. Hello, c'est Bou Youssef.
Micro. Voilà.
Hi, everyone and everybody.
Hi.
Great.
Maybe it's time to start. Professor Khamlishi, welcome. Professor Schwartz, welcome to you.
Thank you very much. It's really a pleasure to be here. I'm so honored that you would ask me to speak to your society, and I look forward to a stimulating conversation and an interesting
Professor Khamlishi, is everyone ready?
I think yes.
Harry.
Hi, everybody.
Hi.
Khamlishi, Dr. Schwartz, Dr.
So,
We can, excuse me, if we can start in 5 minutes, please. In 5 minutes. Thank
great,
you.
okay.
I just want to say again to everybody that really it's a pleasure and an honor to be here. I'm very grateful that you've asked me to speak to you all and participate. And it's really remarkable how we can unite our two countries and through technology and think together about this and rise above the virus that has caused us to be forced to use these types of technologies to come together. But I think we can rise up stronger and use meetings like this to help move the field forward. So it's a pleasure to be a part of this. It's really historic to have these kinds of international Zoom meetings, you know, that allow us to share our knowledge and information so easily and quickly from our own homes. And I'm really looking forward to hearing your perspectives, and also obviously interested in sharing my perspectives and getting your thoughts and see what you think about things that we do here. And we want to hear about what you do there. And obviously we'll learn from each other, which should be very valuable. So thank you.
Come.
I think that this this way of teaching and organizing meeting will be more and more developed with this experience of the COVID-19, because I mean it's more easy to gather a large number of people with this Zooms than if you are in trying to find a big room in a hotel or something, and the cost also is really less important. Of course, the problem is that just we see each other through photos, but not meet each other.
I know. My only regret is I don't get to visit your beautiful country. I've always wanted to come to Morocco, so we'll have to reschedule that.
The same for us, you know, to cross the Atlantic Ocean and to go to different parts. I mean, depending where they are the meeting in the States. The last one in Boston, of course, no one was there.
Right. Such a shame. I think they're trying to figure out whether the next meeting will happen or not. And we still don't know.
Although many of us were already registered and with their accommodation and so on. Anyway, so who is giving the order to start? Is Dr. Ben Zegmoud or?
Hello everybody. Hello Professor Hamdishi.
Both? Huh?
We're waiting for Professor Al-Khdari. He's here now.
He's here.
Hello.
I see him. Hi, Mr. President.
Hi, Mr. Hamdishi. Welcome. Welcome, Professor Schwartz.
Thank you very much. It's a pleasure.
Thank you for having accepted to participate to our webinars. Shall we start?
Yes, we must do so. It's time.
So, thank you, Professor Hamdishi. Thank you, Professor Schwartz, for having accepted to animate this webinar about craniopharyngioma, a pathology that is, despite the pattern, the histologic benign pattern, it's a very challenging problem in their management. So thank you very much to participate to this to give these lectures. And also I would like to thank Professor Ben Zegmoud for having coordinated this meeting, and Professor Darhawi for the coordination and the technical aspects. I thank also Professor Al-Wahabi, Professor Ashuri, and Professor Mustarshid for having accepted to moderate this session. Thank you. So Professor Al-Wahabi or Professor Mustarshid is with us now.
Yes, yes, I'm here. I'm right.
Yeah.
I'm here also.
Okay.
Yes, I'm hearing.
Hello.
Yes, Professor Abdelhak. Yes, can we start?
I'm here. Wahabi, it's to you.
Thank you. Thank you very much. Good afternoon for everybody. Good afternoon for Professor Hamdishi, Professor Schwartz. I don't know if you hear me.
Yes, yes. Very well. Very well.
Okay. I thank the Moroccan Society of Neurosurgery for organizing the committee. And with my co-moderators, we are trying to discuss this webinar with all the participants. As Professor Abdelhakim Khdar said, craniopharyngioma is one of the most challenging surgical diseases. Although it's benign histologically, but it's a chronic disease that behaves as chronic disease. And the surgical management, you know that it's a controversial topic, and with either two options, either radical surgery, which expose, of course, to hypothalamic injury and many visual complications, with no absolute guarantee against recurrence. The other option is a partial or incomplete removal, which is associated with, of course, of higher incidence of recurrences, but with the risk of complication. This strategy of surgical treatment has been shifted from the traditional one, what we know about it, about the 80s, the 90s, what is at that time the most general attitude is to go to remove totally the tumor. But this popular technique at that time was quickly left behind because of complication. And then there is a shift to a less aggressive approach with the partial or incomplete removal of tumors, and followed by adjuvant therapy like chemotherapy or radiosurgery. Today, we have still surgery as the main treatment for craniopharyngioma with two approaches. The one is traditional transcranial one, which has been developed for many decades. And the other, we see that developing the last 2 decades through transsphenoidal endoscopic approach, what you call here from below. But of course, both approaches have their own indication, their complication, their limitation also. And we'll see through this two speakers what is the attitude to adopt regarding the management of craniopharyngioma today. So we have today, we are very privileged to have two speakers with well-known speakers. Professor Absalam Khamnishi has huge experience with craniopharyngioma, and Professor Schwarz also is known about the minimally invasive technique on skull base and pituitary. So we are fortunate today to have this discussion. It's not one approach against the other, but we will see, I mean, the two approaches and their indication. But let me first introduce to you one of the speakers, Professor Khamnishi, and then one of the colleague, Professor Benzamout, will introduce Professor Schwarz. Professor Khamnishi, it is with pleasure that I introduce him to you. Most of you know him. I had the privilege to work with him for more than 30 years, so I know him very well. I started in his department when I was a young resident, and then I joined his team as a faculty in the 90s. Professor Khamnishi is currently director of WFNS Rabat Training Center and the National Neurosciences Institute in Rabat. He is Professor Emeritus and the president of the Foundation for Hassan II Foundation for Cure of Neurosurgical Diseases. Professor Khamnishi spent all his professional career at the University Medical Center of Rabat and trained generations of physicians and neurosurgeons. His dedication to medical training and education enabled him to receive several awards, national and international awards, such as the WFNS Honorary President of the CANS, and a resident member of the Hassan II Academy of Sciences and Technology, just to cite a few. During 40 years of his professional careers, he contributed actively to develop Moroccan neurosurgery to the international level. He also introduced several subspecialties in the department in Rabat, but also in Morocco, such as vascular neurosurgery, skull-based neurosurgery, functional neurosurgery, and more recently, radio surgery. Professor Khamnishi also, when he, after upgrading the Moroccan neurosurgery, he engaged himself and he dedicated himself to develop neurosurgery also in the whole continent in Africa. And he has been the pioneer of the first international reference center for training African neurosurgeon from 2002. So 20 years now ago. And the tens of neurosurgeons from Sub-Sahara Africa has been trained in this center, more than 60 so far. Professor Hamlishi also is a visiting professor in more than 40 universities all over the world, and he gives more than 150 lectures in international congresses. He is also member of several international societies. And in 2005, he organized the first World Congress in Africa. It was in Marrakesh, a very exciting meeting at that time. Professor Hamlishi is a pioneer in many neurosurgical fields in Morocco, but his main field of interest is vascular neurosurgery, skull-base tumor, pituitary, and epilepsy surgery. This is a brief review of his professional career, and it is with pleasure that we invited him today to deliver a conference on craniopharyngioma, one of his favorite topics. And now, before we give him to go to speak, Professor Ben Zarmout, can you please introduce notre other speaker, please, Professor Schwartz.
Thank you, Professor Wahabi. First of all, I would like to welcome our honorable guest, Professor Schwartz, and to thank him for accepting our invitation. Professor Schwartz is a professor of neurosurgery and neuroscience and the director of surgical neuro-oncology, epilepsy, and pituitary surgery at Weill Cornell Medical College, New York Presbyterian Hospital. In 2014, Professor Schwartz has received the first on-the-job professorship in the Department of Neurosurgery at Weill Cornell Medical College and being named David and Ursula Barnes Professor of Minimally Invasive Neurosurgery. Currently, he is the director of the Institute of Minimally Invasive Skull-Base and Pituitary Surgery Program, and also the director of Epilepsy Research Laboratory in the Department of Neurosurgery. During his career, Professor Schwartz has received many awards and distinctions. He is author and co-author of more than 300 scientific article research and 70 book chapters. He has been also in the editorial board of many journals, such as Journal of Neurosurgery and World Neurosurgery. He is also co-editor of 3 neurosurgical textbooks on the subject of endoscopic surgery. And by the way, I would like to congratulate him for his last announced a few days ago about pediatric endoscopic skull-base surgery. So Professor Schwartz is one of the most skilled neurosurgeons in the world, particularly in the field of endoscopic skull-base surgery. He has published a lot in the endoscopic management of skull-base lesions, especially pituitary adenomas, meningiomas, and craniopharyngiomas. And today, he will share with us his experience in the endoscopic and transnasal management of craniopharyngioma, and I'm sure that we will learn a lot from his experience. Thank you again, Professor Schwartz, for being with us today. And without further ado, I will hand over to Professor Wahabi, who will moderate this webinar in coordination with Professor Shuri and Professor Mustarshi. Professor Wahabi, please.
Thank you very much. Thank you. And may I ask Professor Hamlishi to give his talk about the approach of craniopharyngioma from above, that means from transcranial approach. We have looked the histological development of such approaches. So we start first with the transcranial approach and then to the endoscopic transsphenoidal approach. Professor Hamlishi, are you ready?
Yeah, thank you very much, Professor Wahabi, for your introduction. Now I think I need Fahd to help me to...
Yes, sir. You can share...
Je crois, c'est ça?
Oui, oui, partagez l'écran, s'il vous plaît. Oui. Yes, please.
Non? Ça passe, vous voyez?
Oui, 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 on voit très bien. Donc, you can go full screen. Very well, very good. Thank you.
Okay. So thank you very much again, Professor Wahabi, and thank you for the Moroccan Society for the invitation organizers. I'm very happy, of course, to participate in this webinar with Professor Schwartz from New York, and heard your questions and remarks, and to learn together about this challenging topic, surgery of craniopharyngioma. Well, this presentation, you heard me? It's okay? Is it okay?
Yes, it's okay.
So this presentation will summarize our experience on more than 200 cases of craniopharyngioma, which we have gathered in quite a long period, more than 30 years. And as you see, they were operated in two periods. The most important number of cases I have operated in the Department of Neurosurgery, I chaired for 31 years until 2014. And the second part in the National Center for Rehabilitation and Neurosciences, where I am practicing and continuing my teaching activity at the same hospital, fortunately always surrounded by my young colleagues in the Department of Neurosurgery. In less than 10%